Syndromes of disrupted homeostasis is a term coined by Robert Scaer to describe many diseases that are characterized by an alternation between an exaggerated sympathetic response and an exaggerated dorsal vagal response. Each swing of the pendulum causes the return swing, but instead of increasingly smaller swings, the swings become greater over time, and this causes symptoms to appear and disappear, to vary in intensity, and to vary in location. Eventually, static and unchanging organ damage occurs. A common mechanism of damage is an alternation between periods of sympathetic overdrive with insufficient blood flow or ischemia, followed by a parasympathetic rebound engorgement. This causes reperfusion injury. The absence of oxygen and nutrients from blood during the ischemic period creates a condition in which the restoration of circulation results in inflammation and oxidative damage through the induction of oxidative stress rather than restoration of normal function. At a visible surface, evidence of reperfusion injury is an unblanching redness when pressed. For instance, with bedridden patients, it's known that unbalancing redness is the first stage of a bed sore. First comes a lack of circulation due to pressure, followed by a reperfusion injury. Because of tissue injury, an inflammatory response ensues. Autoimmune disorders are in some instances related to this inflammatory response. Psoriasis is an example of a visible disorder that waxes and wanes, is affected by stress, and the basic symptom, overgrowth of skin cells, arises because of a localized immune response in the skin. One can imagine similar processes occurring less visibly within internal tissues. Autoimmune diseases are known to be associated with a sympathetic shift, emotional suppression, and a history of trauma. Each swing of the pendulum causes the return swing, but instead of increasingly smaller swings, the swing becomes greater over time. So from the exaggerated sympathetic anxiety arousal with insufficient blood flow to the exaggerated dorsal vagal shutdown, reperfusion of blood flow. Here are some examples of syndromes of disrupted homeostasis. Reflux. This is where acid flows back from the stomach into the esophagus, which, unlike the stomach, is not lined in a way that resists acid, so damage and pain results. It may be thought that the sphincter has become incapacitated, but the sphincter is supposed to open when food goes from esophagus to stomach and close when the stomach contracts. The problem is one of miscoordination, an autonomic problem. Ulcers have long been associated with stress by everyday observation. In the modern era, where strong attempts are being made to rehabilitate stress as good, other causes are being blamed. Irritable bowel syndrome, Crohn's disease, and ulcerative colitis. The basic cycle is between ischemia and reperfusion, engorgement, and inflammation. Think of the damage that arises when frostbitten tissue thaws. The ischemic periods are not recognized often and are seen as good periods of remissions. The reperfusion periods cause irritation, and diarrhea, and intense pain, and are seen as the flare-ups. Interstitial cystitis. Most symptoms are ultimately from inflammation, which is caused by reperfusion after ischemia. Asthma. Asthma has been intuitively understood to be related to stress for a long time. The exact mechanism is obscure. Perhaps the bronchial walls are supposed to constrict and expand slightly, rhythmically, to aid the breathing mechanism. And if this gets out of balance, asthma results. Chronic hyperventilation also plays a part. Mitral valve prolapse. This can sometimes be a structural defect, but it's most commonly caused by a discoordination between the chambers of the heart and high blood pressure. Fibromyalgia. This is an extremely complex syndrome, which is also extremely common. The progressive myofascial shortening and stiffening effect causes pain, and dorsal vagal symptoms are most credited, but impaired interpersonal relationships probably stem from unappreciated chronic fight or flight effects on the limbic system. Migraines. A period of vascular insufficiency, usually in one side of the brain, causes oral symptoms, the aura of a migraine, and then vascular engorgement follows as a rebound and causes the pain. Ironically, the oral symptoms would be worrisome for a stroke in today's contest of heightened awareness of early stroke signs, were they not to occur in this context. Psoriasis is an example of a visible disorder that waxes and wanes, is affected by stress, and the basic symptom of overgrowth of the skin cells arises because of a localized immune response in the skin. One can imagine similar processes occurring less visibly within the internal tissues. And as mentioned before, autoimmune diseases are known to be associated with a sympathetic shift, emotional suppression, and a history